10 early warning signs of cancer that demand immediate attention. Picture yourself casually appearing on a TV show about your dream home. You're in the midst of giving your first television interview when suddenly a medical specialist initiates a social media call to action. They urge you to go to the nearest hospital without delay because you might have cancer. This is not a hypothetical scenario. It actually happened in America. A specialist observed that a participant had a small lump, a subtle nodule on their thyroid, and by reaching out through this social media call to action, they ultimately saved that person's life. And that's precisely what this video is going to explore. For a considerable period, this individual remained oblivious to any signs of trouble, even believing during the interview that all was well. This video delves into the subtle, early symptoms of cancer that often go unnoticed. I aim not to incite fear, but to provide you with practical advice on recognizing when it's imperative to consult a doctor without delay, rather than deferring a checkup for half a year. Additionally, I will shed light on the process of cancer formation and its contributing factors. It's unfortunate but true that there will be some difficult truths to face, as even the things we cherish most could potentially lead to cancer when overindulged. Moreover, I will have the pleasure of introducing you to someone I consider a personal hero. My favorite cells are actually ones that should be considered superstars by everyone, because these are the cells that can detect cancer very, very effectively and moreover can also combat cancer cells. And our initial early warning sign is related to understanding what cancer truly is. To comprehend this early warning sign, we need to briefly grasp the essence of cancer. Observing normal cell function within the body, it operates in a specific manner. Cells grow, cells divide, and cells die off. These are all highly regulated cellular processes. However, when we examine the situation with cancer, we find that everything changes dramatically, with the exception of that initial point of growth. Cells proliferate and the body continually rebuilds them, synthesizing new material. Ordinarily, these cells divide in a regulated fashion. However, when they cease to die and begin to multiply without restraint, uncontrolled cellular processes ensue, resulting in the development of cellular clusters known as tumors or metastases. The critical issue with cancer is that these cell clusters, these metastases, can become wildly unmanageable. The significant problem we're addressing is the occurrence of massive inflammation. If you suspect that my goal with this video is to instill fear, let me assure you that is not my purpose. It's this very inflammation that contributes to the complexity of treating cancer symptoms effectively. Consider a large tumor that has remained hidden, unnoticed. It has been growing stealthily over the course of several years, perhaps months, and then suddenly you are confronted with undeniable symptoms. These symptoms become so severe that they compel you to seek medical attention. This is precisely why it is of utmost importance to recognize that certain symptoms may serve as early indicators of cancer. Simply go to the doctor and don't delay the appointment for another 6 months. Have some blood tests conducted. The doctor reassures you, hey, everything's fine, allowing you to continue living your life with peace of mind, which is the essence of what this video is about. Regarding inflammation, the initial early warning sign can be related to weight loss. We're specifically discussing weight loss, particularly when it's unintentional. So we're talking about an unintended weight loss of 10% within a 6-month period. Many people are pleased about it and exclaim, wow, I'm losing weight without even trying. But regrettably, this type of weight loss is often a sign associated with cancer. Nutrient deficiencies can result, or diarrhea from colon cancer, or even swallowing difficulties. In the context of thyroid cancer, which is a significant issue, there's a tendency to overlook the weight loss that accompanies it, weight loss that might initially be a cause for celebration. Our second early warning sign is also related to the presence of a large tumor mass. In this case, we're talking about fevers. If you find yourself experiencing unexplained fevers that persist, reaching temperatures over 100.4 degrees Fahrenheit for a prolonged duration, it's likely that an inflammatory response has been triggered or is ongoing, with inflammatory substances leading to the fever. It's imperative to get this symptom evaluated by a healthcare professional. As I've mentioned, the larger the tumor mass grows, the more challenging it becomes to manage the condition effectively. It's important to remember that there are numerous other medical issues that can also cause such symptoms. But as I said, one of the 3 most important early warning signs of cancer is fever that keeps recurring over 100.4 degrees Fahrenheit und also ainkuis o can see to. There are also certain viral infections that can cause this, for example, the Epstein-Barr virus, which we will discuss later. And the third important symptom in this context is night sweats. So if you find yourself having to change clothes constantly 2, 3, 4 times a night, please don't confuse it with hot flashes, which are quite similar. But if you start sweating inexplicably all of a sudden, then also see a doctor and get it checked out. It could also be an early warning sign of cancer, but of course, with every symptom, there are many other possibilities. These three symptoms, weight loss, fever, and night sweats, are collectively known as the so-called B symptoms or B symptomatics. As a medical professional, you quickly become familiar with these signs in the clinical setting. When they present together in this particular triad, it often indicates the possibility of cancer. For instance, in leukemia, approximately 80% of those affected exhibit these symptoms at the onset of their illness. In the case of other cancer types, if all three symptoms are present, they are seen in about 30% of patients. Before we delve into some cancer statistics, I want to offer a comparison with other healthcare systems. Despite the fact that trust in medicine has waned for many during the pandemic, it is important to acknowledge that we in Germany benefit from a very high-quality healthcare system when compared to other nations. We quickly move into cancer diagnostics. Health insurance covers the screenings. Please take advantage of these preliminary examinations because you'd be hard-pressed to find it as good as it is here in any other country, and it's always a good feeling to know that everything is okay with your body. Let's explore some aspects related to cancer. In Germany, cancer ranks as the fourth most common reason for inpatient hospital treatment. It stands as the leading cause of death among individuals aged 40 to 79. Over half of the patients diagnosed with cancer are over the age of 60, and in the year 2021, cancer was identified as the second leading cause of death. Cardiovascular diseases are the leading cause of death globally. Unfortunately, the rate of skin cancer has increased by 75%. And women are dying from lung cancer significantly more often than they were 20 years ago. And we lose about 230,000 people to cancer each year. In 2021, it was indeed 229,000 people. And we have 29,000 Menschen und wir haben in Germany, about 500,000 new cancer cases are diagnosed each year, and at present there are approximately 1.6 million people living with cancer in our country. Before we encounter the next early warning sign, I want to express my gratitude once again. The channel has now surpassed 100,000 subscribers, and I can assure you that I will continue to put forth great effort to create quality videos for you. I am particularly delighted by the numerous new channel members who have decided to join us. They truly make the channel something extraordinary, demonstrating their support, and as a token of appreciation, they receive access to these live streams in a protected area. I would be thrilled if you also decided to become a channel member to not only subscribe, but to join and actively support the channel. The subsequent early warning sign to be aware of is unexplained diarrhea. We have approximately 60,000 new cases of colorectal cancer each year in the Federal Republic of Germany, and it often progresses silently, this particular type of cancer. That's why you've probably seen one or another celebrity promoting colorectal cancer awareness or prevention, because it can go unnoticed for a long time. It progresses silently, and it's a really big problem. The majority of people get sick after the age of 50, men more often than women, and there are good preventive screenings available. Fecal tests, which are done by the family doctor, and colonoscopies, those are just part of it. And make sure to get other symptoms checked out, like the diarrhea, that's one thing, but also other odd symptoms. And what do I mean by that? Other bowel symptoms that could be early signs of cancer might include pencil-thin stools, so if you have diarrhea or bowel movements that are only as thick as a pencil. Persistent or unexplained constipation warrants medical attention. Similarly, if there's blood present in your stool, there's a specific test for that, which your family doctor can administer. Additionally, if you experience gas when passing stool, this symptom should also be professionally evaluated. Moving on to the next topic, which is fatigue syndrome. The markers of inflammation, which are indicators of inflammation in the body, can make us feel exhausted, as seen in cases of cancer. Therefore, if you're suffering from a fatigue syndrome, a type of weariness that doesn't get better with rest, and it persists for more than 6 months, it might be an early indicator of cancer. This is because cancer impairs cellular function, which can ultimately result in a significant decrease in energy levels. Cancer also disrupts metabolism. This can also lead to a deficiency and thus explain this fatigue or fatigue syndrome. What are the most common reasons for fatigue? For example, iron deficiency or an old Epstein-Barr virus infection that can flare up. That also causes tiredness. So, as I said, view that with skepticism too. However, as I previously stated, fatigue frequently serves as an early indicator. Should it continue, seek medical attention. Now I want to discuss my personal superheroes, the remarkable natural killer cells, and I'm excited to introduce them to you through this video. These killer cells are an extraordinary type of blood cell with the unique ability to detect and target not only cancer cells but also virus-infected cells, effectively eliminating them. They accomplish this by releasing a substance that can dissolve these harmful cells, including cancer cells, serving as a crucial protective mechanism for our bodies. Interestingly, we see a connection to another early warning sign of disease, the lymph nodes. Swelling of the lymph nodes can be an early indicator of trouble, particularly cancer. It's one of the most common and significant early warning signs. So it's important to pay attention if this swelling persists for several weeks. If you notice that you have a swollen lymph node, it is advisable to simply visit the doctor, who should conduct a blood test and thoroughly examine it. What could be the underlying connection? The swollen lymph node might simply be a natural defensive response of the body. There are viruses known to cause lymph node swelling, such as the Epstein-Barr virus. However, there are also viruses that can potentially lead to cancer, like certain types of the herpes virus, including the Epstein-Barr viruses, which are part of the herpes family. This includes viruses like the human papilloma virus or HPV, and also like hepatitis B and C viruses. It's fascinating to observe that when these natural killer cells are functioning suboptimally, should a viral infection take place, your body relies on these specific cells to combat it. However, if your killer cells are weak and their activity is hindered, it is possible that over time, be it 5, 10, 20, or even 30 years later, this persistent viral infection might result in cancer. This is because over such an extended period, the body is unable to successfully eradicate the viral infection. What does lymph node swelling signify, and when should you consult a doctor? To begin with, lymph node swelling, which you might have noticed behind the ear or in the area on the side of the neck, is entirely normal. However, if the swelling persists for 3 to 4 weeks, then it's advisable to have it examined by a doctor. This is particularly important if the lymph node swellings arise without any apparent infection. Lymph node swellings that occur during infections are a normal, healthy, and natural immune response. Nevertheless, if they manifest without any infection, without other accompanying symptoms, and if the lymph nodes rapidly enlarge to more than 3/4 of an inch, if you can detect a distinct lump, then it's important to consult a doctor. Now, let's consider what factors might lead to cancer. Unquestionably, smoking, specifically tobacco smoke, is a significant contributor. Lung cancer ranks as one of the most prevalent forms of cancer. Additionally, there are specific chemicals involved. This may be familiar to you from previous reports. Dioxin, asbestos, benzene, PCBs. Then there are heavy metals like arsenic, lead, mercury, and cadmium. You might think, I don't come into contact with these, especially lead. However, certain faucets, due to their metal alloys, can actually release lead into your drinking water every day when you turn on the tap. And I'm aware there's a significant debate surrounding lead in drinking water, with some claims asserting that our water systems are free of lead. Indeed, we don't have lead in the water because it's rigorously tested as it exits the water treatment facility, and it would be extremely detrimental to human health if the water supply was tainted with toxic elements like mercury, lead, or arsenic. But what transpires within the tap at your home when the day draws to a close remains a mystery to most. In my hometown, we had a high school, 2 elementary schools, and a section of the city hall where lead contamination was detected in the drinking water. The water was promptly classified as a health hazard. It became unusable. You couldn't wash food, nor could you use it to brew tea or prepare coffee with it. And this issue was significant until the source was traced back to the faucets, specifically the alloys used in them. Nowadays, there are faucets and manufacturers that assure their products are lead-free. Thus, companies are slowly but surely making the necessary adjustments. Then we have viruses and bacteria. I just mentioned the viruses, but for example, a Helicobacter pylori infection, a bacterium, can be carcinogenic. And then there are things like alcohol, diet, obesity, and of course, certain types of radiation, radioactive radiation. They may be contributing factors to cancer. A chronic cough is an exceedingly common symptom associated with lung cancer. There was someone I knew, albeit not closely. We were together just once, part of a group attending the theater, and it was noticeable that she constantly had a cough. At that time, she was in her early to mid-30s, and none of us really thought it was a serious issue. She mentioned she had been feeling slightly unwell for a couple of weeks. Tragically, the conclusion of her story revealed she was afflicted with an extremely aggressive and exceptionally rare type of breast cancer, which led to her passing away a few months later. Ever since that poignant incident, I've been vigilant to thoroughly investigate whenever patients mention they're suffering from a chronic cough. When should you consider having your cough evaluated? If it's persistent throughout the day, if it shows no signs of subsiding, and if it's not linked to any known infection, it's time to pay attention. Naturally, it's possible to experience a lingering cough for weeks following a bout of severe bronchitis or a similar condition as the body continues to produce mucus in response. However, if the cough remains relentless, or if it intensifies during the night, if it appears to be unrelated to any specific trigger, or if you notice the presence of blood in your sputum, these are signals that you should consult with your family physician. They may suggest listening to your lungs, possibly ordering a chest x-ray. Additionally, blood tests can reveal a great deal, such as the presence of an underlying inflammatory process. I previously mentioned to you the well-known case that was discussed on television, where often a small lump isn't visible, yet individuals report experiencing difficulties with swallowing. Tumor growth in a specific region of the throat can be the underlying cause of such swallowing issues. The act of swallowing requires the coordination of extremely fine muscles, and any disturbance in muscle or nerve activity or even nerve damage due to swelling can impact this process. Additionally, inflammation can lead to alterations in the throat tissue, further impairing the intricate mechanism of swallowing. It's important to be vigilant about these symptoms. If you encounter persistent difficulties with swallowing, it's crucial to seek medical attention and consult a doctor. Moreover, unexplained pain should not be overlooked, as it is often not immediately recognized as an early indicator of tumor growth. It's quite evident that the tumor has the ability to displace tissue, and by pressing against it can cause pain. There's a possibility that nerves may become compressed, pushed aside, or even damaged. Additionally, we are considering inflammation caused by the tumor. Inflammation can invariably lead to pain within the tissue, and indeed, there might already be metastasis present. Certain tumors have the capacity to spread extremely rapidly, and you might not detect any symptoms from the primary tumor. That's the term we use for the original cancer. However, it's the metastasis that tends to cause complications. Hence, there's that age-old adage, you don't die from the primary tumor itself, but rather from the metastasis. If the tumor has already metastasized, resulting in numerous secondary lesions and has spread to other organs, then it can indeed lead to discomfort. Significantly, as we've established from the start, skin cancer rates are climbing. Therefore, it's imperative to keep a close watch on any changes in your skin and to participate in preventive screenings. What exactly are the signs to be alert for? Take, for example, a mole that undergoes transformation, becoming asymmetrical, or experiences a shift in color. These are red flags. If the edges, previously smooth, now appear jagged, this is a cause for concern. Additionally, if the mole's diameter expands, if it enlarges, if new spots or growths emerge, or if there's a sudden onset of moles or other skin irregularities, these are all significant symptoms that should prompt a consultation with a healthcare professional. If they start to bleed, change shape in an unusual way, or develop a small ulcer, it's crucial to take notice and make an appointment with a dermatologist without delay. Beginning at age 35, it's recommended to undergo a skin checkup every 2 years. Digital technology is increasingly becoming a valuable asset in dermatology. You can take a photo of the affected area, send it to a dermatologist, and they can then determine from your images whether the condition is potentially serious or what exactly it entails. Dermatology has greatly benefited from the advent of digitalization. I am a strong advocate for this advancement, as computers often outperform humans in certain areas, such as the detection of skin disorders and in the field of radiology. In this particular scenario, we are delving into the realm of applications where the capabilities of computers surpass the human eye in detecting certain anomalies within the field of radiology. I must clarify that I am not an advocate for the indiscriminate use of AI and digitalization in every aspect. There's no need to delve into that discussion, but it's undeniable that in specific sectors of healthcare, the integration of such technologies is highly beneficial. On a positive note, we boast an exceptionally high success rate in treating various forms of skin cancer. As I've mentioned before, you now have the option to go online, download a specialized service for a fee ranging from $25 to $35 in line with the standard medical fee schedule, and submit photographs of your skin. Subsequently, board-certified dermatologists, actual experts in skin health, will evaluate your condition, providing you with a professional opinion promptly if you sense the urgency for expert advice. I personally find this service to be excellent and make use of it myself. Moreover, it offers clarity on the expected wait time for an appointment with a specialist. Certainly, maintaining an appointment with a medical specialist remains important, particularly when they need to examine something more closely using a microscope. Moreover, if the digital doctor indicates there could be an issue, it increases the likelihood that you'll return to the specialist. You might approach the receptionist and say, "Hey, I urgently need to see the doctor. A colleague advised it's important." I trust this video has been of assistance. I want to stress that the goal here is not to instill fear, but rather to inform and educate. Please consider subscribing to my channel, sharing this video if you found it useful, and joining as a channel member. For members, I host regular live sessions in a private section of this channel. Thank you for watching. See you in the next video. Until then, farewell.